Hello all, good evening. Actually, yesterday I was talking about abnormal uterine bleeding, and half of the thing only I have told about it. And today I thought I will complete what is abnormal uterine bleeding. So up to the age wise you can worry or not worry, I was telling abnormal uterine bleeding. So in reproductive age group, 90% rule out pregnancy causes. If it is not pregnancy, then rule out any internal causes like adenomyosis, endometriotic cyst, fibroid uterus, அது மாதிரி ஏதாச்சும் ஒரு கண்டிஷன் இருக்கும். ஸோ பேசிக்காக ஒரு அல்ட்ராசோனோகிராம் பெல்விஸ் பண்ணால் போதும்னு சொல்லியிருந்தேன். Whereas in perimenopausal age group, what is perimenopausal age group? Perimenopausal age group is nothing but it is a menopause, complete cessation of the periods. Usually what I told was talking about yesterday was a menarche, and it is a first appearance of periods, whereas menopause is last cessation of the periods. It is stopping that age. What is the age limit for it? It also depends genetically. If your mother attained menopause 40 years, yours may be also 40 years. Your sibling attained menopause at 40 years, your menopause may be also 40 years. But usually the Indian scenario age group for menopause is at 47 years to 51 years. That is the normal age for menopause. Okay. So 47 to 51 years kulla menopause varalana, then you have to seek your doctor's advice. 51 ஆயிட்டு you are bleeding also, it is abnormal. That is also constitutional. If your mother is stopped at 55 years, you may also stop at 55 years. So that is, but you have to rule out seeking the advice from the gynecologist. So what is the perimenopausal AUB na? At during the age of the menopause, perimenopause na nearing menopause, like 40 years ல இருந்து ஸ்டார்ட் ஆகும். அந்த காலத்தில் வந்துட்டு நல்லா உங்களுக்கு 40 அப்படின்னு ஒரு ப்ராவபே இருந்தது, பழமொழியே இருந்தது. That means if you are good, you will stop at 40 years. That is, it is not like that. So 40 years and above, they will start with perimenopausal symptoms. That is, they are going to attain menopause, but they are not attained. So எப்படி அது ஆகும்னா, history of irregular periods. Irregular periods once in 1 month, 2 months, 3 months, 4 months, and then continuous bleeding PV. Then it will be a history of passing clots, and there may be any pain abdomen. So many things will be there. So அது மாதிரி irregularity start ஆச்சுன்னா, immediately you can come and seek the advice of your gynecologist, because it may be normal, it may be abnormal also. What is abnormal in it? You may be having some uterine conditions like fibroid uterus, adenomyosis, or endometrial cancer if there is a family history, and so many other causes, cervical cancer, so many other. So unless otherwise you seek advice from the gynecologist, you can't tell everything is normal. So if you want to brand that as normal, it's a normal perimenopausal I am undergoing as a symptom nu neenga nenikanona, first and prior most you have to go and consult your gynecologist, and she has to tell after the scan and doing some internal examinations, it is normal only, you are attaining menopause. That's why it is like that. So you yourself can't take your health on your hands and tell this is only normal at this age group. Illa, my mother told this is normal. No, it's not so. So perimenopausal age group AUB, abnormal uterine bleeding vanda, go consult the doctor, do some internal examination, pap smear, ultrasonogram pelvis, and rule out the internal causes like fibroid. As I told, so many fibroid na kolpu katti, it is a fibroid is a one type of tumor in the uterus which is not cancerous. It is benign tumor, but still it may grow so very big that uterus has to be removed, and it may bleed so very much, so that you will become anemic, so it has to be removed. So that like that it will be. So you have to really get the medical advice for all these things. Next வந்துட்டு postmenopausal, after attaining menopause, after 51 years. menopause எப்போ சொல்லுவோம்னா up to 6 months to 1 year you have to stop periods. ஸ்டாப் ஆயிடுச்சுன்னா அது பேர் மெனபாஸ். இஃப் இட் இஸ் ஸ்டாப்ட் அண்ட் ஆஃப்டர் 1 year you are resuming your periods, it's not normal at all. So it is to be considered pathological unless otherwise proved. Mean to say what? Doctor இது நார்மல்னு சொன்னாலொழிய it is not normal. So it may be a symptom of CA cervix, cancer cervix. It may be a symptom of uterine endometrial carcinoma. It may be a symptom of ovarian cancer, and it may be symptom of so many other cancers. Even breast cancers also may lead to postmenopausal bleeding because of increased estrogen dependent breast cancer. So all these things are there. So don't take your health in your hands and tell happily that this and all is normal, which is not normal, which may not be normal for everybody. For somebody it may be normal, but not for everybody. So go consult your doctor. So 4 age group, menarche, and at the age of puberty you will get and during reproductive age group there will be irregular periods because of PCOS, pregnancy related issues, post abortion, post pregnancy and childbirth, lactation there won't be any periods. For somebody when they are breastfeeding 3 months won't be periods, or 6 months also. Some persons may regain their periods only after 1 year also. So all these things are there. So unless otherwise it is told it is normal, don't take your health in your hands and tell I am normal. No, it is not normal. Okay, thank you.